Lung cancer causes more deaths than any other cancer, with survival rates decreasing as the severity increases. But it's hit a little too close to home for one Stanford professor and physician who's already committed to fighting the deadly disease.
Thank you for signing up the class. I'm really happy that people would reach out to me to want to take. Quite an honor for me, honestly. I know it's hard. I promised myself I wouldn't choke up, and now I'm choking up. I know it's hard.
This is the first day of class. Why is it important for you to teach this class?
Having gone through this as a patient, but also being a physician, I have one foot in both worlds. So I felt like when I was a student, I would have loved to hear an experience from somebody like me. And I think this is something I hadn't seen shared widely before, so I wanted to share that unique perspective. So I was diagnosed with non-smoker lung cancer, never had a puff of smoke of anything in my life.
So you're sitting here in the infusion clinic getting your chemo treatment. How ironic and surreal is this whole experience for you?
Oh, yeah, there was a lot of denial at the beginning as I co-founded CARE, the Center for Asian Health Research and Education, and one of our priority areas is supporting research and education around never smoker lung cancer. And then lo and behold, I get never smoker lung cancer.
How did you find out? Just briefly describe that you had the symptoms.
Yeah, I had a cough starting probably in late February, March, and spring allergy season. I've got allergies. And then, it was getting worse and worse, and it sounded like really I was wheezing. I was able to get a chest x-ray on Monday, and Wednesday got my CT scan. And by Friday, I was already getting a bronchoscopy. So I really had this accelerated diagnosis, and by that next Monday, I had my pathology back.
So what you thought was just a normal spring allergy turned out to be stage 4 lung cancer.
Yeah, it had spread to my brain, to my bone, to my liver. That was where the denial comes in. Then, once the pathology came back, the denial kind of went out the window. I got to deal with this, and I had, in my brain, I had actually 50 areas of metastases. That kind of blew me away. I've seen lots of patients with metastases, right? But 50 is a lot. The MRI really drove it home to me in a way because it was so drastically different than what I was expecting. Next slide, please.
How prevalent is never smoker lung cancer?
It does appear that the incidence of lung cancer in people without a smoking history is increasing. They've been able to show an increase in this adenocarcinoma subtype, which is the most common. In women, there's almost no smoking, and in men, that's come down. But this adeno is going up, and that's what many of us are trying to understand the why.
What is the treatment for never smoker lung cancer and the success rate?
In Brian's case, is stage 4 when it's spread. Stage 1, stage 2, stage 3, we can still cure. But for patients with stage 4 where we can't cure, we do a lot of work to understand more specifically about the cancer. What are the genetic changes in the cancer that make it different? What makes it unique? It's frequently this EGFR, such as in Brian's case. If we find those, then for most of those, we now have these targeted treatments. In Dr. Lin's case, he's taking this osimertinib medication, which is a pill specifically focused to hit EGFR, which we know can improve outcomes dramatically for patients with stage 4. Because he's had such a good response, and we saw in the CT scan today and throughout the rest of his body, the cancers have shrunk dramatically, there's a very good chance that he'll just be on that single drug once the chemo ends for a long time to come. But it's unlikely that the drug will continue working 5 years, 10 years. It's not impossible, but it's unlikely, and so that's where we're working hard to find those next treatments.
This is a life lesson in class. This is your life.
It's my life, yeah. It's my life, and I'm happy to share it. It's sort of like these movie exercises of, well, you've got 1 hour left, what do? You've got 1 day left. Now I think about it, well, maybe I have years instead of decades left. What do I do? And luckily, I've been fortunate where, I've lived my life sort of in that vein already. So I think reflection and optimism are 2 great things to keep in mind if you're going through a new diagnosis of cancer.
And the thought of, I'm going to beat this.
Yes, absolutely. You have to have that optimism. Well, thank you so much for coming. You have to have that optimism that maybe I'm that rare person who beats this, right? And you have to have that hope.